In this video, I'm going to show you the best solution for patients with tight and painful upper trapezius muscles. Hi and welcome back to Physio Tutors. The upper traps are often demonized as the cause of neck and shoulder problems due to EMG studies that show high activity and altered ratios of recruitment. The question, however, is why do they show such a high activity? We argue that this is rather due to weakness, fatigue and pain, as we place a lot of demands upon the upper traps during activities of daily living, especially if the upper traps have to compensate for a weak rotator cuff. Vygotsky et al. In the year 2015 also showed that greater EMG responses do not imply greater motor unit recruitment and therefore hypertrophic potential cannot be inferred. On top of that, Anderson et al. In the year 2014 have shown that high-intensity strength training improves the function of chronically painful upper trapezius muscles. In another video, we are going into more detail why tight muscles have to be strengthened instead of stretched, massaged or released. Click on the info button in the top right corner to learn more. So, how do we best train the upper traps then? Most people think of shrugs as the go-to exercise for the upper traps. However, shrugs are not the best exercise as the fiber angle of the traps are not optimal in 0 degrees of abduction and the levator scapula will have a high activity as well. Castelline et al. In the year 2016 found that the activity of the levator can be reduced in the overhead shrug. To perform this exercise, face a wall with the distance of about a forearm's length. Then place your arms into an overhead position against the wall and perform a shrug movement. In order to progress this exercise, the patient can use free weights and perform the same overhead shrug movement in the air. Be careful that the elbows are as straight as possible and that the patient does not compensate with the deltoids and the triceps. Another great way to modify the classic shrug is described by Pizzari et al. In the year 2014. They have shown that the upward rotation shrug at 30 degrees of shoulder abduction produces higher upper, middle and lower trap and serratus anterior activity. To achieve this position, you can either perform the classic shrug between 2 cable pulleys or perform monkey shrugs. To perform the monkey shrugs, hold 2 dumbbells at hip height with flexed elbows and perform a standard shrug without altering the flexion angle at the elbows. At last, there are several exercises that work the upper traps in a more compound way together with other muscles. Anderson et al. In the year 2008 have shown that simple lateral raises with a TheraBand or dumbbells have a high activation of the upper traps, and from the study of Vatan Prakonul in 2011 we know that abduction movements activate all 4 rotator cuff muscles to a similar degree. Alright, this was our video on what to do against tight and painful traps. Like mentioned earlier, if you are interested in a more in-depth explanation why tight muscles should rather be trained than massaged and stretched, click on the video right next to me. As always, I hope you enjoyed watching this video. Please give this video a like if you did, hit that subscribe button before you leave and check out our newly released Physio Tutors assessment book that contains all of our work in one ebook by a click in the top right corner. This was Kai for Physio Tutors. Thanks a lot for watching. Bye.